Hi, everyone. Welcome back to the Mindset and Muscle podcast. I'm your host, Keshi, and today I'm here with Dr. Tom Ingegno. Did I say
That
that
was
correctly?
perfect. Yes, that was
Okay,
perfect.
perfect. To talk about different, recovery treatments, really, but mostly about cupping. But again, as these podcasts usually go, we don't really have like something like planned. So we'll see what the conversation, like how it's bringing us along. But just a little bit of an intro about Dr. Tom. Dr. Tom is a clinician, speaker, and best-selling author of the Cupping book, which I have right here. We're going to talk more about the book later. But the Cupping book, Unlocking the Secrets of Ancient Healing. He owns and operates Charm City Integrative Health, a multifaceted clinic which provides a multidimensional approach to reducing inflammation, improving circulation, and regulating the immune system to help people thrive. So in addition to a quarter century of clinical experience, Dr. Tom has taught at two universities of East Indian medicine and served as chair of Maryland Board of Acupuncture. And he was featured in both consumer and professional media, spreading his message of health using modern research, traditional practices, and humor to make complex theories and treatments understandable. So Dr. Term's professional passion is to help patients and like-minded practitioners develop no nonsense practices to allow people to maximize their health. So that is a vast already. You can see like an area of knowledge in there in that little paragraph, but I do want to give you the floor to just talk a little bit about yourself in your own words and welcome you once again to the podcast.
Yeah, sure, no problem. I mean, I feel like that's such a formal, like I know that my people gave that to you. That's it's such a formal thing, and really, um, one of my big passions. I always wanted to go into healthcare. I wanted to help people. Um, but I didn't really like the what we call traditional medicine, which is actually, modern medicine. It's not the traditional stuff at all, is it? But within that, like, the system seems flawed. It doesn't really seem to be patient centric. It's disease centric. And not to get too Patch Adams, and you're younger than that movie and that book, but that the doctor who really was focusing on the patients, it seemed like a radical idea, but that was at the core of all traditional practices, even going back to Hippocrates, who we call the founder of modern medicine. So, through a series of just crazy events, I ended up at an open house at an acupuncture and East Asian medicine school. And 2 weeks later, I was signed up for that program and never looked back, and really kissed, goodbye to the, hey, you're going to be a Western doctor. You're going to enter some kind of Western healthcare practice, because I wanted to be focused on the person in front of me a little bit,
Yeah.
and it really, it seems to focus on that whole person, not just this part is being wrong or bad or something. It's how can we support that whole being.
Yeah, absolutely. And you mentioned that like modern medicine is a lot about like diseases and things like that, which is like
Mhm.
absolutely correct. And it's all about kind of like pills and just giving you something to treat maybe like the symptoms, but not necessarily what even is causing it like deep down. But I wanted to ask before we even get into cupping specifically, what are the different treatments I could say maybe that you
Yeah.
work with?
At my current incarnation in the office, it's a bigger list. I'll give you East Asian medicine in a nutshell, right? So the reason they call it East Asian medicine is not to exclude Ayurveda or things from India, but because it's focused a little bit more on China, and let's say even a little bit more to the east of that. Originally, we were saying Chinese medicine or Oriental medicine. Oriental kind of has a not so good connotation. There was even a degree at one point that we called OMD, Oriental Medical Doctor. And the people that were making these decisions were saying, well, we don't want somebody to think that they're going to an Asian medical doctor, which kind of has like, wow, that's kind of weird anyway. Um, but even the term Oriental is kind of antiquated, and I think you can still call rugs that, but you shouldn't be calling anybody else that.
Beautiful.
So,
Okay.
but we wanted to differentiate things from like China's origins and Japan and Korea and some of the smaller Asian countries from things that had an equally long history in India. So that's the big differentiation there. Within that, that animal isn't just one therapy, right? So normally we all get licenses in the States in acupuncture, right? That's kind of the controlled practice. But within that, Chinese herbal medicine or Japanese herbal medicine or any herbal medicine that falls within that system, and it's normally using traditional Chinese concepts, even if it went to Japan or Korea. Um, and I know as I say that, there will be systems that come up and that, no, we don't do that. But so herbal medicine is a big thing. Diet and lifestyle is another big thing. So dietary advice, using the same theory as acupuncture and herbal medicine, but applied to foods that we eat. Exercise, things like qigong, breath work, right? So in India, we might be doing yoga as a therapy, but in China, that's going to be guided breathing exercises that are meditative. Of course, meditation fits into that. And then body work, tuina, shiatsu, all these things that we would call massage here were, channel based using the traditional Chinese medicine theory, but applying that in a manual therapy kind of way. So it's a little bit more hey, let's work on this because you have X, Y, and Z, not, hey, I'm coming in to just lay down and have a nice massage. There's absolutely nothing wrong with that, but this is
Yeah.
outcome based, let's say, not just sit there and relax. And that's kind of the bigger picture of what we would call East Asian medicine. And sure, there's a lot of other little therapies in there that, maybe home use cupping was actually borrowed. It is not Chinese in origin. We'd been using it via the Silk Trade route. And I know I just said we there, but it had been included in Chinese medicine since it made its way to Asia. However, we're not exactly sure where it comes from. But in about 300 AD, Chinese physicians were saying, like, hey, we know you guys are doing this at home. And other physicians are saying, oh, this is beneath us. This is a home remedy. But it is part and parcel of acupuncture because of some forward thinking Chinese physicians. And they said, no, we do this too. Things like gua sha, which is scraping, right? Today they rebranded it as Graston's technique, and you got to buy these expensive instruments. They get upset if you call them tools. But scraping using a Chinese soup spoon, or well, God, now you can get them at TJ Maxx. These little jade or metal
Yeah.
scrapers. For recovery, these are also traditional home practices that are part and parcel of East Asian medicine, but they were done in homes before they were ever picked up by practitioners.
Yeah. And you said cupping, don't really know exactly where it kind of comes from, but I want to
No.
talk about like what is it exactly? And then how did it get maybe like tied into kind of together? How did you get like
Yeah,
into it
yeah.
as well?
Yeah. Yeah. So first, cupping is the application of a cup, a jar. Traditionally, these were water buffalo horns or pieces of bamboo or clay pots that were small enough where you would put fire on the inside. There's tons of different ways people do this, but quickly, and not to heat that jar, but to burn the oxygen out and create a small vacuum, and then adhere that to the body. Now, when we do that, it's pulling the skin away from the fascia away from the muscle, creating a little bit of space. So if we have bad circulation, and we use it a lot for musculoskeletal stuff. So if we were to put that on the shoulder because the shoulder was sore or painful, the idea is we're creating space for older blood, quote unquote. It's not old, blood only lasts for so long anyway. But within that time, to move that out of that tissue, whether it has metabolic waste in it, whether it has inflammatory markers, classically we would say this is stale blood, stagnant blood. We got to move that out, right? Allow that to circulate back to the core of the body to be processed. But in doing so, fresh blood comes in, relaxes the muscle tension, helps heal and promote healing because it has oxygen and nutrients in it. Now, the cup is hitting an area that goes almost 6 inches deep according to modern studies. So most people's shoulders, we can treat the front and actually be hitting deep in that shoulder capsule, right? So that's kind of cool. And really what we're doing is triggering this big influx of fresh blood while clearing out old blood. Now, in the process, that suction, for lack of a better term, is pretty much a hickey, right? That suction is breaking
Yeah.
capillaries at the surface of the body. So that's where we get that telltale, circular bruise.
Yeah.
And within that, even that has a little bit of healing function because over, the week or so that it takes to clean that up, your body has to keep sending fresh blood there to break down that blood, repair those little blood vessels. So we're kind of getting this initial, let's release some of that tightness, get some fresh blood into there, but then we have this reoccurring, like, oh, we need to continue to break down that bruise. So we're still bathing that area in some fresh blood.
Yeah, you mentioned like tightness and then kind of like this tail, but I want to understand a little bit more about how it works because like when I think again about our body, like you said, like it's kind of like blood doesn't just stay in one spot. So like what
No,
is it
no. So
like
what
what is it?
happens when we have it? Yeah, and that's a great point. When we have inflammation, uh, that tissue is not getting the nutrients to it because that inflammation
Mhm.
is slowing down the process of blood, right? We're not stopping that. If we stop that, the area turns blue, gets cold,
Yeah, we
falls
just have to
off
cut it off. Yeah.
eventually, So it's not completely shut down, but especially in those smaller capillaries where inflammation can put a lot of pressure on that, and that could be in the muscle tissue itself or in the blood. Those cytokine markers, lactic acid, those kind of things get stuck in that tissue and inhibit the proper flow of blood. So when we say stale blood or stagnant blood, it is not that that blood is not moving at all. It's just not circulating at the same rate and allowing for metabolic waste to build up in the surrounding tissue.
Okay.
So yeah, thank you
And
for clarifying that because most times people will just kind of go, yeah, it's not moving. No, you're right. It is still moving. It's just not moving as well as it should. And
okay.
I mean, if we're talking about muscle growth, we do need inflammation. That's a natural portion. But when it's unchecked, when it's unregulated, when whatever symptom ends in an itis, right? That is a chronic
Yeah.
inflammation then. And that's what we're trying to change.
So like it's like just for regular people, how do they know like what are some kind of like I don't want to say like symptoms, but what should they look out for that they're like, oh, okay, maybe something is like tight. Sometimes with like some parts of their body they can feel something is
Yeah, yeah.
tight, like I don't know, nuts or something, but in general, like I when I think about somebody, like they don't really know for sure, oh, something is inflamed, especially if
Yeah,
it's not gonna like
yeah. So
like something.
if it's not subjective pain, right? A lot of
Yeah.
us are working out regularly. We're going to be walking around with a little muscle soreness, right? And that's
Hmm.
more of a lactic acid process. That's not, say, bad inflammation. But within that, we can even kind of clear that tissue out too. So people will use it as a workout recovery tool just to get more circulation into that to kind of speed that process of recovery of those muscles up. If someone has just like, you wake up in the morning, you have a stiff neck, there wasn't a trauma, there wasn't an injury, that would respond pretty well, working the traps, working the back of the neck with some cups. It doesn't have to be objective. Hey, I was in a car accident. Now I have, a herniated disc at L4, L5,
Yeah.
and I have radiating pain. Now we can use that, and clinically we do use that, and that's probably where you want to default to somebody who's trained and
Like
licensed.
professional.
Um, but in those day to day, hey, I'm achy, I'm sore. Maybe you have an old injury that's not completely recovered, where it's humid out, or oh, I walked too much yesterday and now I feel it in my quad or my calf. Those are good indications. People will use cupping just for the relaxation effect, and this is a weird effect that happens with a lot of different body work. It happens with acupuncture, but after about 10 minutes of treatment, we have two autonomic nervous system responses. We have fight or flight, the sympathetic, and then we have parasympathetic, which is the rest and digest. So when people are stressed out, they tend to be stuck in that sympathetic, right? if people want to calm down, you can apply these cups to the body. And what tends to happen is after about 10 or 15 minutes, and we see this all the time in our clinic, is we get you out of that fight or flight, we put you into rest and digest, right? So everything kind of naturally calms down. Our blood vessels open up systemically. So not only are we getting more blood flow where that cup is, it's happening throughout the body. Our breathing gets
Mhm.
slower and deeper. And these are all parasympathetic nervous system responses. And the cool thing about that is if we looked at those two lists, our brain doesn't differentiate. So if we start doing things that are calming, and this is even with breath work, right? If we do, what do we call it? Box breathing or 4-4-4
Yeah.
four breathing, right? We start slowing down our inhale and exhale, especially the exhale. And we say, oh, our body must be calm. And then what happens? Our brain waves change. Our blood vessels open up. Our heart rate slows down. And the same thing happens with cupping. Anything we can do to kind of get you relaxed, right? So it sounds like, oh, we're going to stick this cup to your back. And it sounds this very strong, forceful thing. And it can be, but it can be done much milder to just kind of promote some relaxation as well. And a lot of people really come in to clinic just to do that. But the way we described this in the book and what it was classically was like it was grandma's medicine, right? Somebody in your family was kind of in charge of taking care of you before you had to go to the doc, let's say, and that was done in households all around the world, and which is another reason why I'm passionate about it. This doesn't belong to one culture, one people. It was widely spread and shared, and the earliest text that we know of to date comes out of ancient Egypt, but Persia was writing about it within a few hundred years of that. Hippocrates wrote a lot about it. And this is all within, 1,000 years of each other. We do know as a formalized system, the first book on acupuncture was about 2,300 years ago. So this Ebers papyrus, the Egyptian text that mentions it, outdates that to 10 or 1515 BC. So we know people that were using needles therapeutically, but it was referred to as needle therapy. It wasn't a complete system back then, right? So cupping outdates that, and it then through silk trade route and various other pathways ended up in Africa, Russia, Asia, Europe. So it kind of spread everywhere, and we even have records in South America. They refer to it as ventosa, but several thousand years old, they were doing cupping in South America. So we don't know how it got there, right? That's lost to time. But it's an interesting question. Did two people have the same idea at the same time? And then it kind of just flourished that way? Or was there some kind of communication? I don't know. I'm not an anthropologist. I'm not going to make that leap or
The
say something
assumption,
crazy
yeah.
like it was aliens or something.
Yeah. Yeah, absolutely. And so I'm wondering, it could also be like slightly different methods that like with time
Yeah.
when communication did happen, then it kind of morphed into like what we know as like,
Yeah. It's funny because like you mentioned, I was teaching at two acupuncture schools. Every time I talked about cupping, especially at the one in Manhattan that had a lot of foreign students, they would always kind of tell you, oh, my Italian grandmother would put down a big coin and then take a little bit of cotton with some brandy and then light that and then put the cup over that. And then,
oh,
I had Syrian patients that said, oh, the cups in Syria are longer, right? Then they have a neck. And what they would do is they'd roll up a piece of newspaper, light the end, and then put that in. So the newspaper was
mm,
further away from your body. You weren't going to get burned, but that would make the suction stick better, right? And some people
okay,
would say,
interesting.
oh, we would rub alcohol on the inside of the glass, light that on fire, and then put it down, right? So the flame wasn't actually touching the patient. And the
Yeah.
way we teach it in acupuncture schools, the way it was done in China, and I'm sure there's variation there too, was we have a torch. We just have basically alcohol on a piece of cotton, either in forceps or a little tool that we make, quickly insert that and then put that down. Now, the reason I wrote this book, and the reason I think it was a great time to write this book is not only is cupping kind of becoming more popular once again, is we have so many tools that remove that fire part, which is probably
Yeah.
the most dangerous part, right? So we have
Yeah.
silicone cups that literally just squish, the air out and stick to the skin. And we have devices that have pumps, and some have knobs that actually twist to pull the air out. So there's a lot of ways to do this now, and there's even some battery operated, some powered pumps
Oh,
that take the air out. So once we remove the fire and we make sure the cups don't go on too strong, we're even removing the glass, right? So we don't even have to worry about glass breaking. Um, there's so many techniques and devices that are like relatively inexpensive that'll last you a lifetime. So it made sense to, one, hand this back to people so they could do it at home before they needed to go to the doctor. And two, because of its popularity, and this is going back well before Michael Phelps, Gwyneth Paltrow in 2006 ended up going to a red carpet with cupping marks on her back.
oh,
So to be able to give people something that they can do at home, you know, for mild to moderate conditions that are maybe nagging, or something that, they can get comfortable with and do on their entire family and friends, made a lot of sense to me, especially when we've removed the things that are quote unquote the most dangerous about the process.
absolutely. Yeah. And I really want to talk about like that fire aspect versus like what the home method would be too. Just
Yeah.
before we get to that, you mentioned acupuncture as well. And I know like again, massage, acupuncture, there's like hot zone, there's like Cairo, like a few different things.
Yeah,
But
yeah,
like
yeah.
what's the difference really in not necessarily how you can explain a little bit how the methods are for people who don't know too, but like really like what is what should each one really be kind of like trying to treat, and like how do I know when something's happening with me
Yeah.
which one I should try?
Yeah, this is where it's going to come down to, one, the practitioner's knowledge base and what they're experienced with. There's a lot of overlap with all of those techniques that you're talking
Mhm.
about, right? Um, Acupuncture for me has a little bit more specificity than, say, cupping. Cupping is a little bit more horseshoes and hand grenades, right? Where I get points for being somewhere in the area, right? That effect
Mhm.
goes deep into the body. It moves blood in a bigger area than just where the mark is left. Acupuncture does increase systemic circulation as well. But when we're looking at the points, uh, we can do it to release a muscle knot, right? That's one technique that we use. But what we're really trying to do is say, okay, so this person might be here for low back pain, but they're also not sleeping well. They've got all these other symptoms. And we're trying to put together a whole body picture of the person, and then form a treatment that not only addresses that symptom of back pain, but, oh, we're going to help with sleep, we're going to help with digestion, whatever that person needs. It's not just symptom relief is really what we're talking about there. um and I would argue that, yes, cupping and massage and other therapies aren't just symptom relief as well, but it's a little bit more intentional, say, with acupuncture, than saying like, hey, I generally massaged this whole body or this whole person. Why we're putting those needles in certain areas are directly linked to our intake and what we found when we palpated the body, through our questioning, listening, smelling, seeing, all that stuff too. Where cupping fits kind of like a, well, where do you think you should put the cup? That's kind of what drives that.
Okay, I'm thinking of kind of like at the gym for example, if somebody was like trying to lift weights and they hurt their like back or something, lower
Yeah,
back,
yeah.
and they want to try a couple of things. What should be kind of the order of what they try, as maybe going from
So
like don't know really know what went on to more
yeah.
specific to like I know what happened, but I don't know how to fix it.
Yeah. So I mean, that's also, these kind of hypothetical situations are always a little tricky because it's going to depend a lot on severity as well, right? If
Mhm.
this is somebody that drops the weight and they're hitting the floor and they're not getting up, your first stop should probably
Yeah,
be Western medical, get some
yeah,
diagnostic
yeah.
images. If we're beyond that, if we're outside of that, like, hey, it hurts, but I'm still walking
Mhm.
around, I can still function. It's going to come down to severity still. Even then, if you feel like you can do something at home and give cupping a try and get some relief, that's a
Okay.
great thing to try. Certainly never ask a barber if you need a haircut. I'm always going to say you should try acupuncture.
For,
Acupuncture, the number one cause even today, or for people to seek acupuncture, is physical pain. 80% of Americans end up with low back pain at some point in their
yeah.
life. So we do see that a lot. It's kind of our bread and butter. We don't even specialize in that in our clinic, and musculoskeletal pain is always a driving force between, with our patient load. It is going to come down a lot to, well, who do you trust? What modalities are they familiar with? And what does the evidence say? I can show you plenty of studies talking about low back pain and acupuncture, but I can also show you plenty of studies talking about low back pain, cupping, and massage. So it's not either or. It's going to come down to practitioner experience, patient's desires, right? When we talk about evidence-based medicine, yes, we want those double-blind, placebo-controlled driven studies. Those are harder to do with acupuncture,
Yeah.
cupping, and massage, but we can still do some rigorous testing with a control group versus a placebo and actual therapy. And within those, when we also have evidence-based medicine, we don't just want those studies, we want patient desire included, because that drives outcomes, right? If the patient wants to do something, chances are it's more likely to work. And then practitioner experience. If you come in and you say, "Hey, Tom, I want, I booked an acupuncture appointment, but I think I want some cupping," I'll take a look at your back and go, "Yeah, that makes sense. Let's do that." Or, "Hey, here's why I think, in this specific case, I want to do some needling here rather than the cupping." And that's really going to depend on the individual patient as well. What is being said and how are they presenting in front of me. So it's not a bad question to ask, because when all roads should, get you some relief, where do you go?
Yeah.
I would say, like, well, have a conversation with the practitioner. But if you're going to try something at home, cupping is probably your best bet. Why?
Okay.
It's safe, it's easy to do, it's hard to massage yourself. Cupping on the low back is a little bit tricky to do to yourself, but surely
Yeah.
you can get somebody to go, "Hey, stick this on me." Is
Yeah.
a little bit easier than, say, sit here and rub me for a half an hour.
Yeah, for sure. Who should not maybe do like acupuncture and like um cupping as well, both kind of like professionally, like with the fire and at home, which you
So,
said
so okay,
specifically
no
not.
acupuncture at home. Don't do that. That's dumb.
Oh
You
no,
will
sorry,
hurt
I meant
yourself. No, 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 no.
acupuncture
I
as
was just
okay,
like,
okay.
just in case.
Just in
Just
case they
because
oh
it's
yeah.
relatively safe does not mean people should do it at home.
Don't just
Um,
take needles and
so,
stab yourself
so
at
please
home.
do not. I am definitely not advocating for that. But within that, uh, as far as acupuncture, avoiding acupuncture, there is no restriction. You do want to let your acupuncturist know if you have like a clotting issue, whether you're taking a blood thinner or whether you're a hemophiliac, things might need to be modified. And of course, if you're pregnant, acupuncture is absolutely safe in pregnancy. I see people that are coming in from, trying to get pregnant or having difficulties getting pregnant, to, through their pregnancy, to labor and induction, to helping with breech birth, to helping with breast milk production. So absolutely safe for pregnant women in all cycles. We just need to know there's certain points that are contraindicated areas that we avoid. Um, those are the two main caveats within acupuncture. Certainly, if you have a systemic disorder, contagious disease, let the
Yeah,
acupuncture clinic know to make sure that they can accommodate you, right? We don't want to be
yeah.
spreading germs. But even then, it's not a no. Now, with cupping, we don't have any research on cupping and pregnancy. It would be unethical to do so. I would say avoid it. If there's open wounds, we don't cup over open wounds. We don't cup
Okay.
over like deep vein thrombosis, which is going to be like big visible veins. And we're going to avoid skin lesions, irritations. You're not going to cup directly over eczema, even though there are some studies saying cupping is good for eczema. It's treating it systemically. We're not going right to that patch and putting the cup right on.
Yeah, and you
In
mentioned
general, yeah.
you mentioned that thrombosis, like the deep veins. I'm wondering then about like varicose veins as well. Is that
Varicose
also?
veins are not as likely. They're already kind of blown out. They're already like so
Yeah.
you're not so worried. I would avoid them in general. There are techniques in acupuncture where you actually do prick the skin and let out a couple of little drops of blood to help. Even that, depending on the person's overall health and general
Yeah.
circulation ability, you
Yeah.
might see some improvement, you might not. But throwing a cup over an area, the expression is don't spank a crying baby. If that area is kind of
No.
already like beat up, you don't have
Yeah.
to. Unless we're talking about musculoskeletal pain. In that case, yes, you can
Yeah.
cup over it.
And to confirm, you're not saying people who have those can't do it. It's just that they shouldn't do it over that
Over
area.
those areas, right?
Yeah.
And
Okay.
if we're really worried about our vascular health, clear that with your, who's ever taking care of that, your cardiovascular person, your cardiologist, whoever is the one that's kind of keeping an eye on those veins for you. Hey, can I
Okay.
do this as long as they don't do this area, right? There's always going to be some weird condition that like no one knows is there. Like, I
Yeah.
mean, how many times do we hear, oh my God, this person dropped dead because we didn't know this was going on? But in most cases, cupping is not going to be the thing that triggers that. But just to be
Yeah.
safe, if you have a concern, ask the physician that's monitoring that condition in you.
Yeah, for sure. Thank you. And then now let's go into like doing it at home and
Yeah.
who maybe should do it at home or like when should they consider maybe like, okay, a professional do it
Yeah.
versus home?
Yeah. So if you want to if you want to try fire cupping, if you want to use glass cups, leave that to the professionals. It was traditionally done at home for thousands of years. We have so many cheap, readily available tools. Use those. Use the plastic cups. Use the silicone cups. If it's a severity that is not tolerable, right? If you're
Okay.
screaming in pain,
Yeah.
go to a healthcare professional. Do due diligence, please. Make sure you get checked out. If you feel like you need imaging, you need imaging. So that's going to be the Western route. But if it's like, hey, I've done this before, I kind of understand how this works, and I know I'm inflamed, I know I need some intervention here. You can give it a try at home. You may not see too much. Then come into the office, book with a licensed practitioner. You know.
Okay. And I'm at the same time opening like the box and Dr.
Oh
Tom
yeah, I
sent
sent
me
you a
some
bunch of
like
cups too. Yeah.
a bunch of cups too. So I'm just like slowly like kind of like taking them out. I was gonna ask so, like
Yeah.
what
So let me
do
see if I can
people
grab
use?
one so I can talk to you because I know I have them all over the place. And of course,
I know
I,
you that's the thing, like great that I could talk to you from wherever you are, but at the same time, if we were together, I could just be like, hey,
yeah.
show us how to use it.
So
Like
so
what
for
can people use
convenience,
first?
so I sent you the ones with the little handle. They're silicone cups. In the book, I cover the different categories that are most common that you can find on eBay or Amazon or Asian grocery stores too. Have them in the health aisle all the time. So the most useful one, the one that I like the most, are these little silicone ones with a handle. Uh, there isn't a brand. I put my logo on the
Yeah.
back of those. That's my clinic logo. But to put these, they need to fit on the area, and you simply just press down to squeeze the air out, right? So now that's adhered, right?
Okay.
And they
Oh,
tend to work, yeah. And depending on how hard you press that plunger in, will depend on how strong the suction is. Now, the other reason I like these is we talk about a technique called sliding cupping. So when you put the cup on and you just leave it in an area, they call that stationary or static cupping, right? It's not moving, right? Great for like the areas of the traps and stuff. I'm going to put this up here and just let that sit, right? Now, while you do that, you can also move the area, right? You can get some myofascial decompression, is what they're calling it the fancy term now. But classically, it's just moving with the cups on. Now, the other thing is you're not going to break these. So if they do pop off, no worries. If you're in my clinic and we do it with the glass cups, yeah, we got to make sure that none are going to fall off. But the other technique called sliding cupping, we can put some oil down. So if we want to work a whole area, normally this works better with a partner. You put the cup on, not as tight as like all the way on, but you put oil down first, you put that cup on, and then if you want to drag it in one direction, you pull the skin in the opposite, right? So you create a little tightness on that skin so I can slide this, right? And this is it's very intense in some cases, depending on how tight that cup is. And part of it is because now we're scraping the surface of the skin with two edges, but in the middle, we have this vacuum pulling the cup up. So it's really great to kind of get some adhesions in the fascia moving. You'll see instead of a perfectly red circle, you'll see kind of these red bands with those little petechia, which are those ruptured capillaries at the surface popping up like little purple dots. You know,
Okay.
go ahead.
So yeah, I was gonna ask like what can people expect when they remove it, but also like how long should we keep it on?
So in general, the silicone cups are milder, so you can go a little bit longer. I always say the first time you cup someone or an area, right? You would think that the lighter the skin, like paler people would show up brighter. It's not necessarily the case. I used to say that because that's what I was taught, and then I saw darker skinned people having really dark marks,
Mm.
and it didn't make sense. It was, well, it really comes down to how much vasculature you have in that area. If you have a lot of small capillaries, you're probably going to come up a little bit darker. If that area has been very
Okay.
inflamed and locked up, you can also get more blood to the surface because there's more blood sitting there, right? Like we said before, it's not completely frozen there. It's just moving slower because of the relative inflammation. So there's a lot of reasons why that mark can get darker. Now you asked about the time. The first time somebody does it, especially with the silicone cups, put it on for like a minute or two, take it off, see how dark it's going to get. That'll give you kind of a baseline. If we're in that 5 to 15 minute range, as long as it feels comfortable, you're probably okay. But because it's so easy to take it off and put it back on, especially the first time when you're working on somebody else or you're working on yourself, take it off once or twice and check it out. Now you can have multiple
Okay.
cups on at once, right? I think I sent you 6 or something like that. So you
Yeah,
could
yeah.
work a whole area, or you could literally sit there, do 5 minutes at one spot, 5 minutes at another, 5 minutes at another, and work like a whole shoulder or a whole neck that way. So you have some freedom, and it really depends on what you're trying to accomplish and how much time you have.
Yeah.
So cupping is, somebody, the one negative review of the book, and it wasn't really negative. They said, yeah, there was a lot of information in here. I don't feel confident to try it. And it's like, no, I wanted this book to be so straightforward, so simple. You read the book in an hour or two, and then you're like, yeah, let's give this a try. Right. So what I'm stressing there is that it's safe. You have some freedom to be creative. If you go, oh, you know what, I'm noticing a little bit in the low back and then something in the calf and something somewhere on the hamstring, great, hit all of those. That's fine. You're okay to do that.
Okay. And you also mentioned after like 5 to 15 minutes, if it's still comfortable, we can keep going. If not, so would it be painful after or just kind
No,
of like
no. So no, but like if it's gonna work, it's probably gonna work in those 15 minutes, right? If we do the
okay,
fire cupping at the office and I put them on real strong, initially some people are like, oh, that's a little bit much, right? So we have to
okay,
go, all right, either put it on lighter or you let me know if it doesn't calm down in a minute or so, right? So
okay,
what ends up happening is as that initial pull of fresh blood into that area happens, the skin, then the fascia tend to relax a little bit, right? So it doesn't feel as intense. So a lot of times, even with the silicone cups, if they go on, they might, oh yeah, I noticed that's there. After a few minutes, you're like, oh, is that still there? And you reach back and you touch it. No, it's still
mm,
on, but because it's started to reduce the kind of inflammation and get more blood flow there, there's more play in the skin and fascia.
okay, perfect. And you mentioned like again, super safe and things like that. So people who doing it at home, again, are saying I'm not super confident in it. Anything that could boost their confidence, or that if there's anything that they should be aware of at all. We talked about maybe the area that you maybe shouldn't put it on if they have those
Yeah, yeah.
situations, but just besides that, like any risk when they're doing it at home or anything that could like again make them a little more confident to give it a try.
I'm not gonna out a friend of mine, but I won't tell you who it is. But he read the book. He did some cups on his shoulder, and he fell asleep. So he woke up with one still on him, and it had been on him for about 2.5 hours. Now, the bruise is gone. He's fine. No permanent damage, but it took about 3 weeks for that bruise to clear up.
Mm.
So and that is not me, hey, go ahead and fall asleep with them on for 3 hours. That is just me saying, look, if you overdo it, the worst that's going to happen in 99% cases, I don't want to say 100 because there'll be one person that'll prove us wrong, right? um in most cases you're just going to have a bruise that lasts longer.
Yeah, and that is it like does it hurt? Is it like a regular bruise? Like what I know in
So
the book you had
technically,
like
it's not even a bruise, right? A bruise is a hematoma, right? It's impact driven, disrupting the
yes.
tissue, causing that tissue breakage.
Yeah.
This is technically ecchymosis, which is like super nerdy. I didn't even know the word until I started researching cupping because it's the tissue, the vasculature is breaking from the inside out, right? It's not a trauma. It's actually that negative pressure that's pulling it apart. And ecchymosis is basically a bruise, but not due to trauma. So the marks themselves should be relatively painless. You shouldn't be aware of them. What'll happen is the rim of the cup, when you've had it on for a few minutes, kind of like leans in, but it's the same as if you're wearing socks and, like the cuff of the
It's like
sock
okay.
leaves a mark, or you're laying on a lounge chair and you get up and you have the lines in your back. That's going to go away in a couple of minutes as fluid returns to that area.
Yeah.
And it'll level out. It'll be even with the skin. Most people go, oh my God, that looks horrible. But people that have
Yeah.
gotten cupping are like, no, it feels amazing. And you forget the marks are there, right? In most cases, you're not looking at the spots that you end up cupping too often.
Yeah, because like usually like a bruise, like when we get hurt, we get a bruise. We do remember it kind of being here. It just
Yeah.
kind of like still hurts. But
Yeah.
I only did cupping once and it wasn't
Mhm.
at home. But
That's
yeah,
okay.
it was more so just kind of like yeah, if I see it here and it looks scary for the
Yeah.
first time, but then yeah, it didn't hurt. Like I
Yeah.
just went about my day. It wasn't like, oh, all over my back. I
and
was like,
and there's no
oh
real aftercare, right? You don't have to do
no.
anything, right? You just leave.
Yeah,
You're
I
just
just like
done.
go behind, wait
and
for it
and
to die down before going
that's
to the
pretty
beach,
much it.
ideally.
That's pretty much it. Yeah, and it's funny, mentioned going to the beach. Even at gyms now, I see people with cupping marks all the time, right?
I feel
they're
like it's
they're
getting a little trendier.
yeah, and I think when people start to realize how easy it is, right? There's so many companies that have like workout recovery stuff like Hypervolt, right? They make this amazing gun and it's stupid expensive and they've got these foam rollers and now
Yeah.
they've got cups and I'm like, yeah, why are those $40 for two? That's not
Mm.
that's not I can do so much better than that. Well, these don't say Hypervolt. Hypervolt, I don't like. I like your stuff. Don't sue me. But within that, it doesn't have to be expensive to be effective.
Yeah, that's good for people to know too, as like something that are pretty affordable that they could give it a try. So then even if it doesn't quite work out for them, like it's not something that they would have to spend hundreds of dollars
Yeah.
on.
Well, isn't that the
Um,
ideal treatment, right? One,
yeah,
it's relatively cheap because every time we add a zero to the end of a number, it exponentially excludes people, right?
yeah.
So even the book, like I tried to price the book competitively, and like I'm not trying to sell people the cups if they don't want to buy them from me. No, I'm going to show you what cups look like. You go find them online for a price point that you can afford, and clean them out regularly, and they'll last you a lifetime, especially the silicone ones. So why not? Like there's a little investment, but we're not even talking about a doctor's copay in a lot of cases. And then read the book and learn how to do it and be able to practice it on yourself and friends and family, and hell, you can even do it on kids. And really, once you have that tool, like you can share that with your family, you can share that with your friends. And at the end of the book, I talked about, like, healthcare to be living breathing things, we need it to be democratized, meaning it's spread among everyone, right? We don't exclude people, and demonetized. And this isn't my typical like, hey, communism has some real big answers here. This is this is really like, if we want to make this accessible to everybody, it's got to be relatively cost effective.
Yeah. And after they use it, you mentioned cleaning it. So before we get to more
Yeah.
about like the book, last question is would they clean it? How do they?
So these silicone things, and the plastic ones, right? In my clinic, I use some wipes called Cavicide wipes, which are relatively new. They look like baby wipes. You do not want to touch these with your bare hands. I was doing it once, and we have a nurse that comes into the office, and she goes, that changes your DNA. And
Oh
so
God.
since then, I don't touch them without gloves on. But this Cavicide kills 99.99% of bacteria, viruses, fungus, molds on surfaces that are non-living, right? And this is how we sterilize these things, and we wash them too to get any kind of actual like skin stuff off them. But at home, we don't need to be as stringent. So I like Lysol wipes. I like bleach wipes. I've had people say they put them in the dishwasher. The other thing is the plastic ones. If you use a harsh cleaner on them, you eventually, like, the plastic will start to break down, and they look cloudy rather than clean. They start to crack on the inside, which is another reason why I like the silicone. They're good with high heat. They can be wiped out with a whole assortment of things. The old fashioned way is throw them in a bucket, 20% or 10% bleach and water. And you can
Can
let them
people do
just
soap
soak.
and water, or is
Soap
that
and
not enough?
water's okay if you're using the kit on you and your family. And
Okay.
that's what I say even for the dishwasher. I don't know if I want to, put them in
Yeah.
dishwasher with dishes, but
Yeah.
if it's just you and your family, you're not going to hurt yourself. You're not going to hurt somebody else. In our clinic, I don't want you to touch something or even have it on your body, even without, having the skin open, if it's been on somebody else and it's not sterile, you know?
Yeah. Yeah, for sure. Thank you very much. Let's talk a little bit more about your book.
Yeah, yeah.
And a lot of the questions I was asking was really like from there, and like
From the
just
book. Oh, thank
just
you for teeing that up. That made it easy for me.
yeah, and actually it was kind of more like, oh, well, that's something that I didn't even think about questioning before, but now I'm
Yeah.
like, oh, that's something that people would like to know. So I've been asking a couple of those, but I want you to kind of give your version of like why should people get this book in probably fewer words than I would.
Yeah, yeah. So I think there is, and we can say it was COVID, but I do think the movement was starting to happen. I think COVID sped this up. There is a real need to take control of your health, right? And that's eating right, that's moving your body, that's going to your regular checkups, but it's more than that, right? It is how are you taking care of yourself at some kind of schedule, right? So we go to the doctor, we get our blood drawn, we get the standard blood. They go, oh, you're fine, come back in 6 months. But that's not really like, hey, I'm not feeling as good as I could, right? How do we optimize that, right? And there's a whole biohacking movement happening. And, what can we do to our environment or ourselves to improve our outcomes across the board? And there's some real good data there, but there's also a lot of BS. This has been around for so long. We have modern studies on it. We have meta-analysis and systematic reviews, which look at all the data and compare it and say, this is good study, this is a bad study, this one's a mediocre one, but here's what we found. So we have all of that for cupping. So that's one reason. We know that it has history and clinical evidence. Two, it's super easy to use, right? I just want people to understand that, like, grandmas do it not because grandmas are dumb, but grandmas do it because they had this intuitive knowledge of it, right? It didn't have to be, I don't have to know every muscle group. I don't have to know exactly where I'm putting that cup. We know we're going to have a positive outcome based on, kind of what we're seeing happening with the person we're working on. And then three, really, like, taking some control of your own health, right? So many people can make little changes in their lifestyle, right? That like stop swapping out like water for soda or something like that. We talk about those little changes. But hey, I'm feeling sore, I'm feeling a little beat up. well, let me put some cups on and just see what happens, right? The barrier of entry is relatively low, and the possibility of seeing something positive in your own life is really there. So as far as writing the book and why people should read it, it's all of those things. It's safe, it's simple. This is something that's part of everyone's history, right? No one's left out. And it also helps us focus on those things we need to do. When we start feeling better, we start asking those questions. Well, what else can I do? Right? A lot of times when people come into the clinic and they're just hit over the head with autoimmune disorders and all these things, and here's the laundry list of pills I take. No one's helping that person figure out how to take better care of themselves, right? No, you're just going to come in. Well, how do we treat this? How do we take care of this? What can I do at home? And a lot of times, Western medicine is like, I got 8 minutes with you. I'm just going to tell you what I'm ordering, and then you figure it out. And then they're left kind of in the sea of knowledge that's out there on the internet, and some of it's spot on, and some of it could potentially hurt somebody. So if we can start doing traditional practices that at best probably won't do a damn thing, right? That's a lot better
Yeah.
than hey, I took this pill and it killed me. And I'm not saying to avoid Western medicine at all. I'm just saying that, like, look, if there's things you can do that are safe and effective, try those first, and God, that was probably a more succinct way to put that whole rambling there.
No, that's awesome. And if you want to give it a try or want to learn more about cupping, make sure again it's the cupping book, Unlocking the Secrets of Ancient Healing. Again, it's like a quick read. It's not anything
That was
is like
intentional.
intimidating. Yeah. So it's
I want
perfect.
you
So
to
then you can
go
like
in an afternoon. Yeah.
exactly go get it, read it, and then like immediately start like getting things to give it a try. And
And
that's
if you buy it off of
awesome.
Amazon, you can throw a set of cups in the cart with it. Have it all on hand, ready to go.
Yeah, exactly. That's perfect too. So you can just buy everything at once and then can we also get you said the cups from you?
So if you're local to Baltimore, I don't have on my website. My
Yeah.
website's gigantic. It lists all of our services, all of our practitioners, and yeah, just a lot of information there. But we have cups at our clinic that we sell to patients that come in. It's a pain in the ass to ship them, you know.
Yeah, no fair. And then in terms of the book, it would be mostly Amazon then that they would
So we're
okay.
we're listed any online retailer that sells books. We're there. So if you want to avoid Bezos, God bless. I support that. But he's the 9,000 pound gorilla, so I need to be listed there. But
Yeah.
Barnes and Noble, and then a bunch of smaller companies. Uh, if you want the list, we made it real easy. Thecuppingbook.com is where you can read more about the book before you purchase it and see the list of stores, online retailers that it's available to for. If you have a local bookstore that wants to carry it, you can walk in and have them request it, and they'll probably either call me or one of my assistants, and we'll end up doing some kind of bulk wholesale order to them. But yes, you can support your local bookstores and have them request it as well.
Okay, perfect. And lastly, where can people find you?
So the main website that I was referencing is Charm City Integrative, TIVE.com. That is all about my clinic, all the services we provide, and you'll find God, if you want me to come out and give a lecture, my booking information for that. I think I list even my damn CV on there. I don't know if that's an act of vanity or what, but yeah, just anything you need to know about me, how to get in touch with me or anybody at my office, charmcityintegrative.com.
Yeah, and I'll put that in the show notes as well as like kind of all the things that I can find. I believe do you have a YouTube channel as well?
Yeah, it's all my social media is on the
Yeah,
website. I think that is
perfect.
Charm City Integrative. You just search Charm
Yeah.
City Integrative on YouTube.
So if you want to hear more about either cupping or maybe the even the other methods,
Mhm.
and probably just check it out there. But thank you very much. Is there anything else you want to add that I didn't
No,
mention?
I think we covered a lot there.
We did. Thank you so much for your time here. I
Oh, no
really, really
problem.
appreciate that. That was a great conversation, and I'm sure everybody else also had a great time. Thanks again.
Thank you. Thank you for having me.
Okay. And thank you everybody else for watching as well. Have a good rest of your day, of your week, and I'll see you next week. Bye-bye.